All right. Good afternoon, everybody. I would just like to first thank you all for being here. And I'd like to introduce you to two of our best and brightest M3s, who are also founders of the Mayan Community Health Collaborative here at Korean University. So please join me in welcoming Michelle Mariani and Matt Kiblinger.
Okay, we're going to start first by showing a video, just because this panel is about migrant farm workers. The panelists wanted to show you a video of a farm worker first, and then we'll do the introduction.
Yes. On the PowerPoint slide itself.
When I was born in Oklahoma when my dad was working, picking cotton by hand back in those days, 1959. So back then, my dad didn't even know how to write his name. We're in a family, we're 16. My dad had 9 boys and 7 girls. And from there on, we kept on working our way up north. And then we head out towards Ohio, and then from Ohio to Michigan, and then from there on, California, Florida, where there was work, you know. Even though, regardless, my dad didn't even know how to speak a word in English, but my brother, my older brother, and my older sister knew how to speak a little bit, so from there on, we took it out, and we kept on working, and then my dad, like we're a large family, we made it live with my own work.
Okay, we just wanted to start the panel off by having each of the panelists introduce themselves, just kind of briefly describing your role and how it relates to the experiences of migrant farm workers.
Hello, my name is Ricardo, Ariza, and I'm the Director of Multicultural Affairs here at Korean University. And I'm also Vice President on the board of the Catholic Migrant Farmworker Network, which is a national organization. And so about 10 years ago, I was blessed to host a national conference of 156 migrant leaders on this campus. And from that conference, a white paper was created, and then from there, for the last 8 years, have led Migrant Journey Service learning trips, taking students on spring break service trips to migrant camps nationwide, 7 states, and doing learning assessment on the experience. And from there, we formed this coalition. And so with migrant education, and University of Nebraska Medical Center, and we were able to impact the rural migrant community here in Nebraska. And so, why am I here? Is that now or later?
Just kind of relating to your experience.
Okay. Probably most important thing that I need to say is that my grandparents were migrant workers, and I wouldn't be here if it wasn't for them. So I give honor to them today.
Hi, my name is Aida Olivas, and I said, I'm from Mexico. I have an accent so strong. If you don't understand me, please, you can ask me again. So I work for the Nebraska Department of Education migrant program. So I'm a statewide recruiter. So my job is just interview families to make sure they qualify for the migrant program. What I do is I go to the fields and interview families, and sometimes the school refer families, new families. And most of my job that I do is in the rural area that nobody can find them. That I go in those places. And what I'm here is I care for the families, and what I want is justice for them. So.
Good morning, everyone. I'm Athena Ramos. I work at the University of Nebraska Medical Center. I'm part of the College of Public Health, the Center for Reducing Health Disparities. I've been at the Med Center now for 7 years, but prior to that, I was here at Creighton too. I have a strong passion for social justice, for organizing people, and for advocacy. And that's something that I've tried to hold true to in all aspects of my life, including my work. So I came to Migrant Farmworkers as something that I'd heard a lot about. I'd seen lots of documentaries, and finally I took an ag medicine course, an agricultural medicine course at UNMC, probably the summer of 2012. And I thought, they focus a lot on farmers, but nobody's really talking about the plight of farm workers. And so I figured I'm going to write a paper about farm workers. And out of that paper, I came to apply for a pilot project through the Central State Center for Agricultural Safety and Health. And that pilot project is actually the impetus for bringing the three of us together. And we formed a migrant health coalition here in Nebraska. And the idea behind this study was to actually go out there and see what are some of the health issues that migrant farm workers in Nebraska are facing. Because really nobody has good data about how many workers are here. Like when I was preparing the application for this pilot project, the latest data that I found was like from 1993. Okay, so that was more than 20 years before I was applying for this project. So there was a great need for accurate data, and nobody even really knew. This was an invisible population in our state. And so we applied, we were successful, we got funding, and we're able to conduct this study, which I'll be sharing more about later today.
Thank you very much. So kind of the way we were hoping this discussion to go is we could talk about some of the disparities that exist currently, and then we could talk about what's currently being done to address those, and then we can move on to what needs to be done in the future. So maybe we could tackle that first question now. What are some of the disparities that through your line of work you've seen in terms of like healthcare needs or in terms of access to healthcare in this population?
Thank you. So migrant farm workers, national data suggests that there's between 3 and 5 million migrant farm workers in the United States at any given point. But we really don't do a very good job of helping migrant farm workers to lead healthy, successful lives. There's a lot of barriers and challenges to their health. First of all, agriculture. Let's start there. The industry itself. You wouldn't think about this. I guess I never really thought about it, but agriculture is the most dangerous industry that's out there. There are more fatalities in agricultural industry on any given year than any other industry, except for mining when there's a mine accident. But in general, agriculture is the most dangerous industry. Agricultural jobs are called 3D jobs. One, they're dirty, they're demanding, and they're dangerous. And so with that comes a lot of health implications. So on a national level, there's a number of health issues that we see with migrant farm workers, for example, being exposed to pesticides, exposed to harsh weather conditions like sun and heat. There's issues with having water, running water and sanitation facilities at the fields and at the camps where people are working. And there's a lot of occupational injuries. So fatalities is one aspect of it, but there's a lot of occupational injuries. So for example, there are issues with musculoskeletal injuries, eye injuries, respiratory illnesses, especially depending on the type of work that people are doing, whether they're in the fields working with crops or if they're working with animals, but a lot of respiratory illnesses and skin disorders that come out of that. General health concerns, I would say that there's problems with access to health care. There's serious concerns in behavioral health, which I'll share more about here in Nebraska. And as with any population, there's a lot of chronic diseases. When you mix poverty with lack of access to care, you have some serious chronic conditions that also come about. So as I mentioned, we had funding to do a project here in Nebraska. We actually went out in 2013 in the spring and summer, and collected data from 200 migrant farm workers here in Nebraska from 5 central Nebraska counties. And what we found is that on the physical side, nearly 1 out of 5 migrant workers had been injured on the job. The most common injuries were related to the back and to the feet. As you can imagine, from bending over and having to be up and down and walking fields, that makes perfect sense. There were also some concerns about hand injuries and wrist and head injuries as well. About 25% of our workers that we talked to rated their self-rated health. You know this question: how would you rate your health? Excellent, very good, good, fair, poor. So we gave them that question, and about 25% of our respondents said that their health was poor or fair. Now, if you compare that to what you find on in the general population, that's a lot more. That's almost more than double, about 1.5 times what you would find in the general population. In terms of physical health, there's a lot of concerns. Now, speaking about behavioral health, which includes mental health and substance abuse, we did find that almost 40% of our respondents were smokers. That's a huge, huge disparity from the general population. About 40% were also considered to be problem drinkers. Depression was rampant. Nearly 50% of our respondents were depressed. And about 30% of our respondents, so about 1 out of 3, had high levels of stress, which would be of concern. And about 83% of the people we talked to had no access to any type of health care, whether that be physical health or behavioral health care.
But the problem of health needs is also we don't have community health. That if someone, a worker, got injured, they don't have health insurance, how can we help? So who's gonna provide health care for those guys? So we need to just think about it, to think how can we help those migrant workers. They're the people that are bringing food to our tables every day. So if we are not providing quality health care, who's gonna bring that food to the tables in the future? So.
One of the interesting things that happened when we went out to the community to do assessment, we met with Nebraska Department of Social Services to find out how many migrant workers were in their area. And we were told by social services they had absolutely 0 migrant workers in their area. And then, so we listened to what they had to say, and then that meeting ended, and then we met with Migrant Education. And they said to us, and there were probably 4 or 5 individuals there at that meeting, each of them said that they could take us to at least 50 to 100 different families in that same area. And so what that addresses is we have families living under the radar, okay? And if there is an injury, go ahead.
I'm sorry.
Okay. If there is an injury, to expose themselves and go to get care puts them in jeopardy, okay? One of my experiences in Colorado with the sheep herders from Peru and Bolivia was that in Mexico, these workers were here on H-2A visas, and they were exempt from employment and housing laws, being paid 99 cents an hour on a 3-year contract. And these workers would work with 1,400 sheep, and they would have minimal contact with humans, and they were told not to speak to anybody but the ranchers. And so they would develop mental health problems. I mean, carrying sheep all day, bah, bah. I mean, that's the only contact. I mean, and so again, that social isolation causes problems. And poor diets, eating lamb, sheep meat every day, and hardly any vegetables. And so, again, those were some of the problems that we faced when meeting with the men.
Thank you so much for sharing. And it's quite clear that there are a number of disparities that this community is faced with. So we kind of like to go off of that, and our next question would kind of be, what programs and resources are either currently in place or are needed in the future to address these disparities?
So there are a number of resources that do exist nationally and also locally. Ricardo alluded to one, and I'll let him talk more about that, but that is the Catholic Migrant Farmworker Network. There is also a Migrant Clinicians Network, Migrant Health Promotion, Farm Worker Justice, a number of organizations that are working more on a national level on creating good policies to help farm workers. Locally, we do have migrant health clinics in Bridgeport and Alliance, and we have a number of federally qualified health centers, which perhaps could see some of the migrant farm workers, maybe. But overall, I would say that there's a great need for more bilingual and bicultural programs. There's very few people who understand the plight of migrant farm workers and have that commitment to be able to help people. I think that this type of work really takes cultural humility, and I think that's one of the things that as future healthcare providers that would be very important for you to really develop and reflect on your own behavior, on your own biases, on what you bring to the job, and figure out ways where we can help ourselves, train ourselves to be a little bit more humble in what we do. I think some of the other ideas that I have to help people within our state are mobile clinics. There's not a lot of that happening, whether that be with an actual mobile vehicle that goes to communities or sending maybe nurses to different communities, increasing the number of community health workers or promotoras that are available to conduct programs. I think there's also a great need for non-traditional health education. So when you go to communities, taking a flyer or printed materials, it makes us feel good that we're giving people something, but in reality, it's probably not that useful, okay? So one of the things that I've seen going on in the national level is the idea of using theater to help educate communities. So having a cine comunitario, like a community theater, happening in the evenings in the camps. Also using the camps as an organizing platform so people can learn English, can learn different skills. So it's more than just coming in and providing a health service, but we're providing services to help people move up the social ladder. I think overall what's needed are some serious changes in our social policies. There's problems with our employment law, there's problems with our immigration policies, and we need a cultural shift, right? So instead of trying to clamp down on our borders and on our communities, we really need to be more opening, more welcoming to the people who are here, because by not doing that, we're creating this divide, a greater divide between our communities, which is harmful, I think, in the long run.
Okay, and I'm going to talk about my areas because I'm from Hastings, and Hastings, I think, has been doing a wonderful job with Catholic Social Services. They're the one, and when summer starts, they call me Aida, like how many migrant workers are going to be around Hastings. So we get together and we talk about how many. A year before, I'm calling the crew, hey, like how many workers are you going to bring? So we are ready. So in other areas, rural areas, are like at churches. I always are welcome to help me. And also Head Start program, which Hastings has the migrant program in Hastings, so they're the one they're helping me out.
I want to say that we're unified in our faith commitment to social justice and dignity and respect for all. And we have multiple disciplines here, and it's important that each of you look at opportunities to do interdisciplinary work. And not one profession holds all the knowledge or has the ability to open the doors with this population. And so for us at the university level, we talk to Aida. She's on the ground. She's with those families each and every day. Her office is out of a car. Literally, out of her car. And so showing respect to that level of human contact is really, really important. And so I think that interdisciplinary work is so important. This organization that I belong to, the Catholic Migrant Farmworker Network, it deals with faith formation. It deals with legal issues, social issues, pantries, whatever the needs are. And so across the nation, working with migrant workers and working with the Mayan communities, and I was talking to these people here last night about the Mayans here in Omaha and the Mayans in Ohio that I got to know, and some of those same people are in the fields. And so I think it's really, really important that we serve the people who are providing the food to our tables each and every day. And so, but again, that partnership development is critical.
Okay, so we still have a few more questions that we kind of came up with to ask our panelists, but I wanted this to be like as interactive as possible. So I'd really like for anybody who has questions, this is your chance to pick some of the brightest minds in the field right here. So do we have any questions from the audience already? Okay, so there's a lot. We can start here.
When you were discussing disparities, we've actually done a paper on migrant farm workers last semester, and we're wondering how large of a role the possible undocumentation or immigration plays in not seeking care or being afraid to seek care.
Nationally, the data suggests that about 50% of all migrant farm workers are undocumented. Even here in the state, we found basically two groups of folks. There were like the traditional migrants, kind of like the gentleman that you saw, Arturo, in the beginning, who have made their lives as migrant farm workers. And then there were also the folks on the H-2A visa, which is the guest worker visa program for temporary seasonal agricultural work. Now, I do think that immigration status does play a big role in being able to access care. Number one, there's a fear about being undocumented and going into care and having somebody find out that maybe you are undocumented, and there's misperceptions out there, misinformation that people are going to call immigration and you're going to get deported and all of these things. And so I think it does deter people.
And also, on my job, since I work for the school, I cannot ask those questions. So if they're moved from anywhere, if they're looking for agriculture job, my job is to just do recruiting. I'm not allowed to ask those questions.
I think that Flint, Michigan gives us a perfect example of that, where we have lead contamination of the water, and we have the government has made a policy that they will go out and give water to home by home, but they have to show a social security card to receive the water. And so that's a contemporary example of what you asked.
So I was wondering, so I'm from Colorado originally and have worked at a community health center that actually does have like a mobile outreach unit to rural areas in Colorado. And from what I gathered from a lot of the people that have experience in the mobile unit, was that like sort of the mentality of migrant workers in Colorado at least was sort of to have more of like a seasonal migratory pattern and ultimately get back to Mexico, get back to their families, and like the long-term goal was never to stay in the U.S. And so when talking about immigration policies, things like a path to citizenship and things are not exactly what migrant workers are looking for. Could you comment a little bit about sort of the mentality of migrant workers here, what their ultimate goals would be in terms of like a U.S. policy that would best serve what they're looking for in their lifestyle and their like economic goals, I suppose?
I think it needs to be framed from the perspective of a transnational citizen, someone who wants to contribute to the economy and work hard and save money. And it's just kind of like the natural order of things. The birds migrate. Many four-legged ones migrate. And humans should have the right to migrate to sustain life. And I think that should be at the core of any policy that we develop for our country. Because it's in the best interest economically, because they are contributing, tax-paying individuals. And so
some of the families that move from Mexico, their mentality is to save money and to go back to their own country. But they stay here for 2 or 3 years and they say, okay, we're going to go and build a house in Mexico. In 2 more years, I'm coming back. So they're coming. So, and we have to respect them. So.
I think one of the problems that I see is with the H-2A visa program. One is that this type of guest worker program really sets people up at an unequal status. This visa is connected to the employer. And so folks who come on this visa, they must return to wherever they came from. So the visa is good for 5 years, but they can only be in the country for a specified amount of time. So for example, if the farmer says, I need people for 8 weeks to harvest my corn or whatever, that's what they get. They get people for 8 weeks and then they have to go back home. But as part of this H-2A visa program, they could return the next summer or the next growing season when the farmer would request them again, but they could not go to a different employer. So in a way, I think it could be seen as a little bit of a modern day slavery because this visa program also sets up some regulations that are not enforced. For example, an employer who has that H-2A visa, so the farmer or the contractor who has that visa, they bring people, but they're supposed to provide them with housing, safe, clean, healthy housing. Doesn't happen. Haven't seen it. And at a national level, that's one of the discussions that's happening among people who do this work with migrant farm workers is how do we improve the housing because it's in terrible conditions. The folks that we saw here in Nebraska, I think were better off than a lot of the other migrant workers that I've seen in terms of the housing. Number two, that visa program, they're also supposed to provide food. Doesn't happen. Maybe they get a sandwich or they get a can of green beans. You can't tell me that that's enough for somebody who's out in the field 8-10 hours a day. That's not enough to sustain them. So that type of work and lack of regulation really sets people up at an unequal status, and it really does drive, I think, a modern day human trafficking, a labor trafficking problem in the U.S.
So last year I went on a service and justice trip through the SDSJ downstairs, and we went to Kansas City, and in Lexington, Missouri, we were on a migrant farm, and it was very like hush-hush that we were even going there delivering food, and we talked to the migrant farmers, and I just kind of wanted to know like the similarities, like is it pretty much the same all throughout the United States, but these migrant farmers were from like Jamaica, Haiti, Central America, and based on the crop, they would float from cities, so they couldn't really even establish like a sense of homes because they were in Lexington, Missouri, but then they were moving, like in the next 2 months, they're moving up to like Wisconsin, and then it was the same situation that you guys were talking about, like their fear of getting health care, and then even if they were to miss for like, maybe like they sprained their ankle or got like a wound, if they were to miss, they would just be cut out completely and then easily replaced. So I just wanted to know if that is like the same thing that you guys have seen.
The short answer is yes. Yes, it is. Traditionally, there are 3 streams of migrant workers that come through the country. So there's a western stream that comes up from Mexico, California, Oregon, Washington. There's a Midwestern stream that comes up through Texas, sometimes through Ohio, Nebraska, Michigan, Minnesota, up that way. And then there's an eastern stream on the eastern side of our country. And traditionally, people do follow the crops within those streams. But as we have more of these guest worker programs, people are coming direct to one place and leaving out of the country. So it really depends on, I think, on the immigration status and if they have that particular visa.
Also, we have in Hastings a group of 50-something migrant workers. As soon as they're done in Hastings, they go to Iowa and then to Illinois. So, but yeah, that's it.
There was one community that we experienced in North Carolina, and we were shearing Christmas trees, and the workers tended to be returning and would stay there 6 months of the year and work for 6 months, and each year would return, and they would have their housing was taken care of, and so there would be 8 to 10 men in one house. There was transportation, a truck for the house that they could use. There was a woman was hired from the community to cook for the workers. They were paid $7 an hour. They worked 12 hours a day, slow season, and 18 hours a day during Christmas tree harvest. And they would use the machetes to shear the trees. And when we arrived, we said that we would work a full day, and within 3 hours, all of us were like this. We were having muscle spasms from holding that machete and shearing the trees. So we spent 3 hours working, and we spent the rest of the day eating ibuprofen to deal with the pain. And so we weren't very good workers. We would have been fired. And it's just like picking asparagus. I remember cutting asparagus, and the labor boss, the field boss, came to me and said, "Ricardo, you were so bad at cutting asparagus. You cut one and 2 grow up behind you." So again, my point is, oftentimes this is called unskilled labor, and it's not. It's skilled labor. You have to know what you're doing. Pruning, cutting the grapevines, preparing them for the season. If you cut them wrong, that whole vine will not grow for another year. So think about the impact of that. So you really have to know what you're doing. Skilled labor.
Okay, millions of questions, but one, when they're on these H-2A visas, I mean, obviously you can't survive on 8 weeks work and then go, I mean, do the 8 weeks work, they go back home and they're working at home and that just supplements? Because I can't see how you could, if you couldn't go and follow crops and keep working, that was one question. The other question was, how much resistance do you meet from the farmers, the ranchers, the people that own, you know, essentially these businesses or co-ops or whatever it is? I mean, are they allies, or are they working against, you know, making some of these changes?
Okay, when they come to work for 6 months or 6 weeks or 7 weeks, they go back to Mexico, but they live in poverty the whole year. So, and they're anxious to come to work at the United States. So they're living in poverty, bad. And now the situation in Mexico is bad with delinquency and bad. So they really want to come and make money. So they don't want to spend the money buying food here in USA. So what I would like to do in the future, and I think Hastings is doing a wonderful job. Catholic Social Services is providing, and the first week, we provide 2 meals in the morning and the night, and I'm in charge to go to the hotel every day. But it's not my job. But so somebody has to do it, and I ask for help for the other moms, families in Haiti. Hey, can you help me with the migrant workers to make tamales? Because they don't want to spend the money here because the food here is so expensive. In Mexico, you have everything, so it's not that expensive. So.
I think the migration moving from one harvest to the next has a significant impact. And when we held that conference here 10 years ago, that was the one thing that their voice brought out that issue in saying to the Catholic Church, the man-made rules of the church are keeping the sacraments away from our children. They cannot make their sacraments. So how is that right? And could you reevaluate that? And so that was put into a white paper and taken to Washington, D.C., to the United States Catholic Conference of Bishops. And boy, it caused all kinds of ripples in the pond. But again, the migration of, following that migratory pathway, they get used to that. And then they return, and there's that belief that the streets in the United States are filled with gold. And they think they're going to make a lot of money. And so oftentimes they leave very, very disappointed in the amount of money that they make. And I've seen like the little spiral notebook where this young man, 17 years old, he was keeping track of every payday. Okay? And one year we organized with Legal Aid of Nebraska, and we trained 5 students to go into the rural areas of Nebraska and do a Know Your Rights campaign. And we went to churches, we went to parks, and we educated the workers. And then 2 years later, our little packet of information showed up at Legal Aid of Nebraska, and it resulted in a $1 million lawsuit against Monsanto, where 56 workers said that Monsanto told them you would be paid this amount, and then when they went to receive their checks, they received only half of that. And they were told, you are undocumented workers, take what you get. You have no way to complain. So again, that advocacy and that care for the workers is very important. So again, we have to be advocates on multiple levels.
I was wondering about the interdisciplinary piece that you're mentioning. We have groups like Doctors Without Borders that go overseas to help people that have issues. I mean, is there anything within the continental U.S. or North America that can provide that kind of care and outreach from, social, medical for migrant workers? I mean, it seems like if we can do it for people overseas, why can't some of those efforts be replicated in country programs for people that really need it? I mean, I can't imagine that there wouldn't be a groundswell of physicians and nurses and social workers who wouldn't, do something like that. So is that something that you guys look at or work on or develop to try to do something in country for migrant workers?
There are a number of organizations that do some work. Migrant Health Promotion, for example, or the Migrant Clinicians Network are two examples that are doing some of that and bringing different groups together to try to help migrant workers, but they're not everywhere. And so they're in high population areas: Texas, California, Arizona, Florida, North Carolina. But there's migrant workers all over the country, and so in areas like Nebraska, it isn't happening. It's happening at the ground level, through partnerships, through our own social networks of, hey, I'm going to go do this. Why don't you come on with me? That's how it's happening here.
Yeah. In Stockton, California, there's an organization that feeds the migrant workers and the homeless, serving 8 to 1,200 individuals per day. And this organization has, and I can't remember the name of it right now, but I can get it for you, Patrick. It has 5 employees. It has 100 volunteers. It has a medical clinic, and each day there's a different doctor there to serve. There's a dental clinic, there's social workers, there's educators, 100 professionals strong. They commit one day of their week to this initiative, and they're doing amazing, amazing work. And it's so cool to have our students go into the kitchen, and there's culinary artists, chefs, who volunteer their time and come in there, and they're showing their skills and bringing the level of the quality of food to a higher standard. And at the same time, I've been to places where they'll line up those number 10 cans, and there'll be 20 different kinds of soup. Clam chowder with beef stew, and mix them all together, and then cut up vegetables and throw them in, and then cut up big rolls of bologna and throw that in. And when you look at it and you smell it, it's like, wow, how could you even begin to feed someone this? I wouldn't even feed my dog, but I witnessed. And so again, it's really important that we find model organizations who do the interdisciplinary work and then recreate that. We don't have to create the wheel ourselves. We need to find them and say, okay, let's use this prototype.
I think we had one more question over there. About the last one.
Okay, sorry, it's for recording.
Oh, okay. I guess my question is, you kind of touched down on it. Who's doing it right? Is there a country or a nation anywhere that's doing this better than ourselves that we can model after?
Great question.
That's a good question. I don't know that I know a good answer for you. From all that I know, everybody is struggling with the issue of migrants across the globe. I don't know that anybody really has a perfect solution to it.
I think we have to come to do a perfect solution, but we don't know. I think we have to come together, agencies and people, to help those migrant workers.
I don't have the answer, but I think a start is for each and every one of us to bring our best spirit to the table and to really show respect and dignity to all people. And if we start there, we can have something that's very quality and giving and life-sustaining.
Thank you, everyone, for your great questions. I have just one more to kind of quickly go over, and then we have a few PowerPoint slides. But I was just wondering, we have a lot of people here who are local to Omaha, and I'm guessing we have a few people who came from maybe a little ways away as well. If anybody sitting in this room right now wants to learn more about migrant health workers, some of the disparities they're facing, can you kind of point us in the direction of some resources we could go, if you have any books or websites or even organizations locally that maybe people want to get involved with and maybe even advocate for this population? Can you kind of point us in that direction?
So first off, on the table over here where y'all signed in, we have a flyer for you about an overview of the study that we conducted, but on the back is a list of resources that exist for migrant workers both locally and nationally. So there's a number here, like the Nebraska Migrant Education Program, Proteus, which helps with some job training, Legal Aid of Nebraska, although they cannot serve people who are undocumented. I point you in the direction, if you're interested in immigration, to Justice for Our Neighbors Nebraska. They're a great organization of lawyers who provide legal services free of charge to clients all throughout Nebraska and western Iowa. The migrant health centers that are here in Nebraska are also listed, and then there's a number of hotlines that we've listed for you as well for different health issues and that may be of interest to migrant workers. Another one that I mentioned before was the Migrant Clinicians Network. They create a number of educational materials that folks could take with them when they're going to communities to help with the outreach. I brought one example of that, and this is like a glossary of safety words that you'll find on the farm. So a lot of us don't know. I mean, if you're not working on a farm, you probably don't know what all the equipment is, but this might help you to know how to call that in Spanish. So they do have tools like this that are available for folks. There's a book that I read, I'll give it to you in a minute. There's a book that I read a couple of years ago, and it's by a medical anthropologist. His name is Seth Holmes. He wrote a book called Fresh Fruit, Broken Bodies. I definitely encourage you to check it out. It's a wonderful ethnography. And so Seth actually lived with some indigenous migrant workers. So they were coming from southern Mexico. He crossed the border with them. He stayed with them for a number of years and actually wrote this book based on his experience with them. But one of the things that he pointed out in the book is this idea of clinical gaze. Is anybody familiar with that term, doctors in the room? Clinical gaze. So trying to reduce the clinical gaze, which means that you start to see your patients as people, not as a condition. So over the course of time, we've lost that personal connection with people. We've lost that relationship building. And patients come in and we say, what's wrong with you? What's your problem? Where's it hurt? That's our first line of questioning. And that doesn't help to build those relationships. And so trying to reduce that type of activity and really start to see your patients as people. And then being able to connect those patients, if you do get the opportunity to see them, to meet with them, connect them to the resources. So be familiar with what's out there and make those connections for people, because most likely if you give them a brochure and say, here you go, that connection is not going to happen. You're going to have to make those connections for people. So I wanted to end my part with telling you that people are not commodities. Although people are working in commodity industries like agriculture, they are not commodities, and we cannot afford to treat our workers as if they are. So I think we all need to be really committed to the cause. So if you want to work with migrant workers, great. I applaud you. But be committed to the cause for the workers. This should not be an educational adventure just for you.
There's flyers that talk about migrant education program. There's a website, and you can go online and see. There we are statewide. We go everywhere. There's the migrant workers. So, and also there's my information in the flyers. If you have a question, you can email me anytime. So I would be happy to answer any questions.
I'm available here in this building on the lower level, and so you can contact me anytime. But again, the Catholic Migrant Farmworker Network, if I can get this URL right, it's cmfwn.org, and again, cmfwn.org, and it's a website that has many different resources available and national contacts. I would also encourage you to go out to the United Farm Workers organization that was founded by Cesar Chavez, and they continue to do fantastic work in California. And of all the programs that I've seen, the programs serving migrant people in California tend to be 10 years advanced because they have so many workers there, and they've been doing this for a long, long time. And so I guess the last point would be through the different, when we go to a different community, the archdiocese of that community welcomes us with open arms, and they're doing migrant ministry, and oftentimes farm workers have the relationship with the ministries, and that opens up the doors. If we go in, I've been in Florida and spent 3 days trying to get into the fields because the weather impacted the area that we were going to travel to, and so we couldn't get into the fields, so we had to find another location, and literally spent 24 hours searching and received no. And on the very last day, we were able to get into the fields in the morning out of the 7 days. And so again, it's not easy to do. And you have to have relationships, and you have to know who to talk to. And again, it's about building that rapport, that relationship, and that trust. So.
Okay, well, we just wanted to thank you so much. I feel like this was pretty eye-opening for most of us here in the audience, and we just wanted to allow you to wrap this.
Yeah, so we wanted to remind you that addressing health problems with migrant workers is really about addressing the social determinants of health. Anybody familiar with that model? Your healthcare professionals, I hope you all have seen this model. You can go ahead and press the slide one more. And this is a reminder that social policy, any social policy is really a health policy, and we've got to remind other folks who are in charge of making these policies, our lawmakers, that these are really things that impact people's health. Even though we're talking about transportation, we're talking about housing, we're talking about education, we're talking about employment, immigration, these are health policies, and they have health implications. So that's an important reminder. For us, we have hope. All of us who are working with migrant farm workers, we have hope because the people themselves, the workers themselves have hope. And we're here to support them and really be that instrument to help them lead better lives. One more. So if you got food, thank a farm worker. Thank you.
All right, guys, if you didn't sign in, please make sure to sign in before you leave. We need that for your